Minister.
Thank you, Mr Deputy Speaker, and could I just start by congratulating and thanking the Honourable Member for Kirkcaldy and Cowdenbeath for securing this important debate and putting on the record some very, very serious points which I have listened to and will read with great interest. And can I just also pay tribute to his own personal experience as a very respected professional clinician in the fields of oncology and adolescent cancer in particular. And I, as someone who has brought a different expertise to this House, it's hugely valuable, and I really welcome his input. I'm grateful for the opportunity to respond on behalf of the government. I think actually the points he's made are probably better answered really by somebody from the Department of Health and Social Care, but I will raise the points he's made with them. In particular, some very important points about infection control in the new post-pandemic landscape, and the points he's made about the importance of learning the lessons from the pandemic procurement emergency, for that was what it was, and the lessons for us going forwards in terms of a sustainable and vibrant diagnostics sector, and the concerns he raised on behalf of his constituent Craig Engels, I think he said, in terms of the investments, the issues around Omega, the reliability of the lateral flow test in particular, and the new pathogens, and the point that the Honourable Member for Strangford made, I think is well made, and Belfast University in Northern Ireland is a diagnostics powerhouse, in fact, and I'm very well cited on that in the heart of our science, superpower and innovation plans, and I'm looking forward to revisiting Belfast to see that work. Mr Deputy Speaker, in the 3 minutes I have, I can't deal with all the points that have been made, but I will pick up the specific questions the Honourable Members raised and write to him with an answer. I think it's worth just saying that the COVID pandemic was the most extraordinary, unprecedented emergency that we faced, the first pandemic we faced as a generation. And if you cast your mind back to 2020, I've got until 5:30. Oh, I won't detain the House unnecessarily, but that means I don't need to rush quite in the way that I might. But if we cast our minds back to January, February 2020, the truth is we were confronting completely unprecedented national decisions and emergencies. Government was, there was no playbook for this. And I say that as somebody who, sadly, I wasn't able to bring my expertise in the sector to government at the time. I was liberated of the burden of office, Mr Deputy Speaker, on February the 13th, the Valentine's Day reshuffle. In fact, my last government role was to attend the first COBRA meeting on what was then called the virus emergency. Yes, I'm happy to give way.
I thank the Minister for giving way. I think one observation that I made, and I may be professionally slanted in this, but one of the observations that I made was that we had lots of very academics who were involved in the decision making at COBRA. But there are extremely capable and experienced senior nurses and emergency clinicians who deal with major incidents day in, day out. And they are the ones who understand how to run an emergency, and they are the ones who understand where the gaps could be. And I would just make this very gentle suggestion. I have a bit of a professional hero, Louise Bowden, who was chief nurse at UCLH and got us through the 7/7 bombs and also the Admiral Duncan pub bomb. Unfortunately, I was on duty as site manager for both of those, and it wasn't very pleasant. But when you have somebody of that capability, I would suggest that would the government consider having somebody with that major incident experience in the room when they're planning these things in future.
Yeah. Well, the Honourable Gentleman makes an important point, and look, I don't think he'd expect me, given that I wasn't the Minister at the time, sadly, I would have loved to have been, but I mean, I don't think it's a state secret to say that clearly there were mistakes made in that national emergency, and that's why there is a proper and full inquiry, and I think he's made some important points that need to be picked up, but I don't think he'd expect me to give a running commentary here on those decisions that were taken. But he's raised some really important points, and if we cast our minds back, Mr Deputy Speaker, you'll remember there was a 2 or 3 week period where we were worried that the lack of ventilators would be the great crisis, and there was a national ventilator challenge, and innovative groups all around the country were stood up to try and design ventilators. Engineers worked out how you could. I mean, all of that happened in very fast order, and there are all sorts of issues raised, procurements, flagged that in the end we didn't need. So, I mean, I don't think anyone would say that it was a seamless process. It was a national emergency, and there are clearly many lessons to learn. I just wanted to deal with the sort of bigger points that he's made, and I'll pick up perhaps the specifics in detail in a written reply. But as former Minister for Life Science, I would just make this observation that one of the things the pandemic revealed is that things that we'd done 7-8 years earlier in the coalition paid not just the 4x return on investment, which is traditional in this sector, but many, many times over. And the truth is, the reason we were able to sequence the COVID virus so fast was because of the launching of the genomics programme, which I was very proud to have led back in the coalition. The accelerated access review we put in place, the parallel approvals process with the MHRA, the early access to medicine scheme, the setting up of VMIC, which myself and John Bell in 2016 suggested would be a sensible piece of foresighting to invest in vaccine manufacturing. It's clearly going to change. We had no idea, of course, there would be a pandemic, which meant that that facility was suddenly incredibly important and urgent for us to have. And the establishment of NHS Digital. I think one of the lessons of the pandemic was the importance of really good data and the importance of having national data sets, but also local data sets. And as an MP in Norfolk, in my constituency, I remember being frustrated that we didn't really have the granularity of data or the ability to do public health by cities, districts. It was done by big, clumsy government regions. And I think there's all sorts of lessons in there about how in an emergency, yes, it requires national implementation and measures. It also requires a subtlety of local control and empowering the local experts on the ground who are best equipped to work out how to contain and to control. But I wanted really to focus where I can add perhaps most value to this debate in the important points he's made about the importance of the diagnostics industry. And I think one of the great lessons of the pandemic, actually, which has absolutely been taken to the heart of government, is that we need to recognise that globalisation is going to drive more and more infectious disease challenges. And, I mean, God forbid we have another pandemic of this type, Mr. Deputy Speaker, but I think you only have to look at the last 10, 15 years. We've had Zika, we've had Ebola, we've had Covid. It is very likely that we will see more of these, hopefully local, regional, but potentially, if we're not ready to contain them, global outbreaks of disease. And globalisation will drive the release of new pathogens. And that's why pathogen detection is one of the technologies that I'm putting at the heart of our 3-year plan going forward. And indeed, we're investing in, and I'm working with the Chief Scientist, Sir Patrick Vallance, on how we can make sure that we harness our leadership in genomics for broader pathogen detection across animal, plant and human health, and make sure that we've built off the back of the pandemic that network. But he makes a more specific point as well, which is that in the both the healthcare system, the NHS here, the care system, but also in the life science industry, diagnostics has really for years, I say this as someone who spent 15 years in the sector before coming to Parliament, it was always slightly the poor relation of the sector. Drug discovery, the pharmaceutical sector tended to raise the big money and have the higher profile. But in fact, it's the diagnostics that the pandemic revealed are absolutely key if you really want to get on top of the disease. But also, the life science industry is moving to recognise that actually if you want to deliver real value and if you want to reduce the cost of disease, which is the real key to the economy and to the health system, then we need to build diagnosis in much earlier. And that's both, if I may call it, basic diagnosis of easily detectable and treatable diseases, but also the deeper science of longer-term diagnosis of tomorrow's conditions. And that's why in the life science vision that we set out last year, the update to our life science industrial strategy, this next 10 years, we've insisted on closing that gap between the traditional dichotomy in government where my department, BAYS, sponsors the research and DH does the procurement and the licensing and the approvals, to try and build to a much more integrated model where we focus on diseases in places and the patient pathway and bring diagnosis, treatment, prevention together around those 8 disease missions. And one of the things I hope and intend for that to do is to put the diagnostics industry right at the heart of those missions, so that instead of being traditionally the diagnostics industry has tended to be the black box that sits on the hospital ward, these days it's becoming absolutely integral to the life science industry working out how to treat disease and how to understand and detect. So I think those missions are completely key. And to reassure the honourable gentleman and other colleagues here this evening, we are investing heavily in this next phase in both the mRNA technologies that are absolutely key to the next phase of detection and diagnosis, the new treatments. VMIC, actually, the Vaccine Manufacturing Innovation Centre, which we set up as an academic unit to work on future vaccine manufacturing technologies, suddenly became, during the pandemic, an urgent facility for onshoring. And so I'm pleased, actually, that we have transferred VMIC into the hands of Catalent, a world leader in mRNA diagnostics and therapeutics and treatments. So we have established a much more robust national supply chain for both flu and other respiratory diseases and other pathogens. So I do think many of the lessons have been learned, but there is more to do, obviously. And we've set out in our latest life science vision an £8 billion commitment to research across MRC, deep research on my side, as it were, of the portfolio as Minister at Bayes, and $4.5 billion into DH and the National Institute for Health Research. The NIHR, about $1 billion a year, is the sort of engine of research under the NHS. And at its heart, crucially, we've said that the diagnostics piece has got to be absolutely central to that landscape. And that's both the influenza and other respiratory pathogen detection, but also the molecular diagnostics, the biomarkers, the genomic insights into disease. Because the truth is the NHS is a huge procurer daily, as he knows, the honourable gentleman knows very well, of blood tests for individual conditions. But if we properly integrate that, then we'll be building up a database of deep expertise in biomarkers, in understanding what are really the early signals of disease, and we can harness that to make the NHS much more of a diagnostics research engine. And those missions, the 8 missions, 8 diseases, the dream, the aim is that we'll then be able to mobilise patients much more quickly through digital technologies into trials. Patients through charities can enrol in clinical research, and using that spine of biobank and the molecular diagnostics piece, we can start to give industry much quicker access to the patients who are on the front line of the conditions that we need to treat. And that, I think, should drive a virtuous circle in which we detect earlier, treat earlier, attract investment. And it ultimately, as the honourable member says, we move from a paradigm where the NHS, under cost pressures, is a low price and often late procurer to a scenario in which the NHS doesn't have to be a high price payer, because it's giving industry the even more valuable thing, which is access to patients and charities and disease and patient consent for research. And the NHS's role in this sector is as a research engine. And I've been very clear to industry, we will never, in a publicly funded healthcare system, be the highest price payer. You wouldn't expect us to be, but the promise I can make you is that we will move heaven and earth to be an earlier adopter, an earlier tester, the best place in the world to come and test, diagnose your new treatments, get the data on which patients they work in, and then you can use that to go around the world and sell to other countries. And I think that is the vision, really, of the NHS as a 21st century research engine. I'll happily give way.
Thank you, Minister, for giving way. Minister, you early on referred to Queen's University of Belfast, and I know you have a particular interest in being there and involved with them. Is there any way that you can maybe indicate that if Queen's University in Belfast or any other universities in Northern Ireland have been involved in this type of research and partnership? Because it's so important to take advantage of all that massive amount of knowledge that there is in that sector.
Yes, the honourable gentleman does make a really important point. It invites me to signal again my support for what's going on there. And if you look at the cancer outcomes in Northern Ireland, the truth is that the Queen's University team, who've been working on biomarkers, earlier detection, have ended up driving not just investment, but also much quicker, much better outcomes for the people of Northern Ireland. And that is the real power of this sector, is that it delivers better healthcare for everybody in the values of the NHS, but also attracts investment and drives industry. And I would go so far as to say that in the new landscape, we will see companies like Randox developing very affordable consumer diagnostics kits that can help drive earlier detection, building onto a digital interface, and we can then help support patients to get into trials earlier and to drive that research medicine piece. And I think Belfast, Northern Ireland is actually on the front line of that. I perhaps just close by just highlighting... Yes, I'll happily give way.
I'm really grateful, and it's been an excellent debate this evening. In York, we had a company which was developing aptamers in order to be used in the diagnostic process, and government didn't have a grip on the governance and the understanding of the capability of what can be produced and the quality that would match. And therefore, how is that mapping process being done to ensure that every part of the manufacturing process is brought together?
Well, the Honourable Lady, not for the first time, makes a really important point. And not being a minister in DH, Department of Health and Social Care, I better defer to them on where they are in terms of that specific mapping point. In terms of my responsibilities at Bayes, we are, as I think she knows, very carefully looking to grow the innovation economy by mapping the clusters of expertise around the country, including Bio Yorkshire, which I came up to visit recently, and to make sure that we are aware of and supporting those clusters of research around the country. And I would just at this point, seeing as I've been invited to comment on other geographies, highlight how proud I was that actually the Norwich Research Park was the first place in the country to establish a local testing facility and the local testing infrastructure to process it. And I think one of the things the pandemic revealed is that whether it was on test and trace or data or local epidemiological control, the best people are the people on the ground locally to get on top of it. And I think one of the lessons of the pandemic is, yes, you need strong national leadership, but you also need to free up and trust the clinical and professional judgment of people on the ground. Let me just highlight, because I think for the record it's important just to speak to the scale of the diagnostics challenge in the pandemic. At peak, over 700,000 PCR tests and 74,000 genomic sequences were done daily. So this has been the most extraordinary turbocharging of our diagnostics infrastructure, and I think everyone is aware of what we owe the diagnostics industry, which needs to be put on the record, but also that infrastructure must be maintained for future events. I would also just highlight that the genomic sequencing technology has been completely fundamental to this. The groundbreaking analysis of the combined SARS-CoV-2 genomic sequences and the epidemiological data has supported the uploading of 2.7 million of the 10.7 million genomes in GSAID, the global initiative on sharing avian influenza data. So we are leaders, because of that genomics investment, we're now leaders in the global networks for genomic sequencing, and over 2 billion lateral flow tests have been provided across the UK. I'm conscious of the time, Mr Deputy Speaker. I think with the permission of the House, I'll deal with the detailed questions the honourable members raised, but I hope I've reassured colleagues that we've absolutely learned the lesson that this diagnostics industry is never again the poor relation, that emergencies require us to learn the lessons. We won't have got everything right. That official inquiry is important. I'd like to take the politics out of it and make sure that the clinical lessons are learnt, but I can assure him that we are determined to make sure this industry is put four square at the heart of our life science vision going forward.